I'm very happy to see everyone in here. Yeah, let's get started. So for those of you who don't know me, my name is Anna Jeffries. I am one of the board certified music therapists here at Harmonic Changes. I'm a board certified music therapist. I'm also a certified neurologic music therapist. And I am here today just to talk to you all about one of my passions and my specialty in my career, which is, excuse me, thought I got that, which is music therapy in collaboration with speech therapy. So in this presentation, we're just going to go over a little bit of what this looks like. What is speech therapy? What is music therapy? What are some techniques that we can use? What are some similarities? And we'll just kind of dive a little bit into this. And then if you have any questions, you are more than welcome to, you can write them in the chat and I'll answer them later. Or you can just wait till the end and then we can kind of go from there. So without further ado, let's get started. All right, so I want to give a little bit of personal background on myself as to why I am giving this presentation. So I am a board certified music therapist. I'm also a certified neurologic music therapist, which is a training that you have to take or that you can take. I just realized, I think one of my bosses just logged in, that the neurologic music therapy training is a training that you take about 32 or so hours to complete it. And it's focusing specifically on music's effect on the brain. And we'll go a little bit further into this as we progress on. I also have a minor in speech language pathology from my university. So I have spent a lot of time working specifically with speech clinics and working with clients who need extra help in speech and language. And that's why I said I worked in a speech clinic for about 4 or 5 months. And then after that, for my internship for music therapy, I worked at a rehabilitation unit in a children's hospital here in Los Angeles. And I collaborated with speech therapists as many times as I physically could. And it became truly a passion for me and what got me to dive a little bit deeper into this. So let's define the therapies, shall we? Just get that out of the way. And first things first, what is music therapy? Music therapy is a clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music therapy interventions can address a variety of healthcare and educational goals. That is kind of the main way of saying it. It's the broad way for people who do know more about music therapy. We know that it is, in short terms, it is addressing clients' goals through music in whatever way that we can. And we address, multiple goals from social to emotional to physical, musical, cognitive, communication. We can just keep going. The list will go on. Specifically for speech language pathology. Speech language pathology, or SLP. I will be calling speech language pathologists SLP in this presentation. I will also be referring to speech language pathology as SLP. They work to prevent, assess, diagnose, treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. So a main similarity that you can already see so far is that music and speech therapy both can work on communication, language, and social skills and cognitive skills. So go from there. So going again more into the similarities with speech therapy and music therapy, music and language are both universal to people. There are different types of, obviously, with music and language, but it is overall universal to everyone. Both have the elements of pitch, timbre, rhythm, and durational features, which we will be going into a little bit more in the next slide. Spontaneous speech and spontaneous singing typically develop within infants at approximately the same time. So once you start hearing your infant start speaking a little bit more in that spontaneous way, you might be able to start hearing them sing a little bit more as well. Music and language have auditory, vocal, and visual use. So both also have a written system. So obviously we can write music. For people who are musicians, you can read music. Same thing with language. We learn to read and write. It's the same kind of thing. And last, never least, that there are distinct forms of music and language that exist in various cultures. So, you know, as we say, it's a universal, they're both very universal and that everyone can use them, but they might have their own way of using them. So continuing on, so I have this picture that kind of describes the similarities and the similarities between speech and music in terms of the aspects of speech. So we have meter. So, you know, with music, we have meter of just the time signatures. But with speech, you know, it's the pace at which we talk. Do we, you know, how do we say certain, or how fast do we talk? You know, do we talk really fast? We talk really slow. Same thing with rhythm, you know, and for music, what are the notes? And are there eighth notes, quarter notes, et cetera, et cetera. And then for speech, you know, how do you say your words? Is there more of a, do you say words a little bit closer together or kind of face them apart? Melody, your inflections in your voice, you know, with melody and music is how high notes go, how low notes go, you know, continuing on. And that's the same thing for harmony too, is, you know, truly the inflections in your voice and how we speak. Dynamics, are you a loud speaker? Are you a quiet speaker? Pitch, do you have a higher voice or do you have a lower voice? And then timbre is just your voice in general. So, you know, do you have a nasally voice? Do you have more of like a deeper chest voice? Do you have more of a lighter head voice? It just depends. And then with timbre, you know, it's the different noises with music. So these are some examples of some neurological and neurodevelopmental disorders benefited by both speech language pathology and music therapy. So you have stroke, TBI, which is a traumatic brain injury, Parkinson's disease, aphasia, any type, global, expressive, receptive, any aphasia, Alzheimer's and dementia, cerebral palsy, muscular dystrophy, or any developmental disorder, you know, whether that could be ADHD, autism spectrum disorder, Down syndrome, any developmental disorder. So let's go a little bit into NMT, so neurologic music therapy. I'm going to be referring to it a lot as NMT, and we'll talk a little bit about it and, you know, the importance of it, especially the importance that it plays in music therapy combined with speech therapy. So NMT is a research-guided clinical model that is driven by advances in neuroscience and the understanding of the perception, production, and performance of music and how music can influence and change the non-musical brain and behavior functions. So we use music to, again, it's the same thing of like the general music therapy definition. We use music to help our clients and, you know, achieve their non-musical goals. It's the same thing, but more focusing a little bit more on the brain and how music affects your brain specifically. NMT, neurologic music therapy, is a therapeutic application of music to cognitive, sensory, communication, and motor dysfunction. So that's kind of a key point that NMT focuses a lot on. You know, we do use it specifically with speech and language, but that's not the only thing. We also work with cognitive, motor, memory, and I have a slide that will describe that a little bit more. NMT is also a standardized system, of clinical techniques that uses the functional perception of all properties of music to train and retrain the brain. NMT is also made of standardized treatment techniques, which is what we will also be going over today, which are applied to therapy as therapeutic music interventions and are adaptable to a patient's needs. So, you know, we have in NMT, the interventions are very structured and should be performed a specific way. But if that way does not particularly, you know, work the best for your client or for your patient, client, child, we can adapt them in any ways that will provide that best treatment. So this is kind of the overarching, you know, way that NMT and music kind of, or music coincide. So we have the language, the memory, attention, motor control, emotions, perception, and executive functioning, and all the little subsections in between. And this is all what NMT can hit upon. So there's a lot in there. And today we're just focusing on the language function of it. So these are all the speech techniques that we use, which is melodic intonation therapy, MIT, vocal intonation therapy, which I will call VIT, oral, motor, and respiratory exercises, which I will be calling OMREX, music speech stimulation, which we will call MUSTIM, rhythmic speech cueing, which we will be calling RSC, therapeutic singing, we're just going to call it therapeutic singing, developmental speech and language training through music, which we will be calling DSLM, and then symbolic communication training through music, which we will be calling SYCOM. So we're going to start with one of the main techniques that we use in music in neurologic music therapy, which is melodic intonation therapy. This is one of the main things. It's the most structured intervention that we have in NMT. So this treatment technique is developed specifically, it's primarily for expressive aphasia. or any aphasia in any kind. We can use it primarily in that, but it can also be used in fluency disorders, articulation disorders. There's a thing you're gonna be seeing a lot called dysphagia, I think it is. No, I'm sorry. It's a disorder where your muscles and your the muscles that produce speech are impaired. So we'll be going, dysarthria, that's what it's called, sorry, dysarthria, and that it also works with that. But it's used for rehabilitation, which utilizes a patient's unimpaired ability to sing. That's very important, is that singing can still last even through aphasia, to facilitate spontaneous and voluntary speech through sung and chanted melodies which resemble natural speech intonation patterns. When using MIT with aphasia or in any diagnoses, the emphasis is to increase the linguistic and semantic aspects of these utterances. So really making sure that it is, in the intonation of your sentence is very on point, that it makes sense to work with it. And the way that we do this is by using a metronome, and we build up with a lot of structure. So using a metronome, finding a phrase that I always think of is how are you? When you say how are you, you think how are you? Then you would match notes to it, saying how are you, and adding in that metronome. And with those techniques, you continuously just keep using it with your client. When you're using the metronome, it is important also to tap your patient's hand, and just repeating that over and over again until your client or patient understands and is able to copy it back to you, and then slowly fading away all the structure until they can use that full intonation. This technique is also used by speech language pathologists. It is technically supposed to be a specific intervention for neurologic music therapy, but speech language pathologists have been known to use this as well. Vocal intonation therapy, it's pretty similar, but with less structure than MIT. So it is using intoned phrases to produce, again, more intonation, to simulate prosody, inflection, and pacing of normal speech. So this is done through vocal exercises, which train all aspects of voice control, including inflection, pitch, breath control, timbre, and dynamics. An example would be to sing a 5-note scale. So we're going to use the phrase, let's go out and play. So we would be using a 5-note scale to imitate some parts of the speech. So when you want to say, let's go out and play, we'll just go, let's go out and play, using that over and over again and again until a client uses it. It's very important, again, using it with, it's important to use it when a client is having difficulties with inflections. We're going on to OMREX. OMREX is the oral motor and respiratory exercises. This is a very, very, very good intervention to use with speech language pathologists, because you both can use different techniques, but it's still kind of considered OMREX. So, and it involves the use of musical materials and exercises, mainly through sound vocalization and wind instrument playing, which you can and can't do, it's up to you, to enhance articulatory control and respiratory strength. So a lot of this is, this is important for, developmental disorders, dysarthria, muscular dystrophy. It also can be used really great, or it can be used really well as a warm up for your session. So using, if you remember, for those who are in choir, doing those sighs, the top to bottom, can technically be a part of OMREX. Buzzing your lips, using different stretches, especially the muscles that help produce speech. So like neck stretches, facial stretches, opening your mouth up really wide, closing it really tight, all of that jazz. And yeah, we just use those, and that is considered OMREX. And then a big thing too with speech language pathologists is that they can also get into this, because they can use, if they have a client that needs a little bit more articulatory support, they can use any consonants and use any techniques that they need during this to assist their clients. MUSTIM. So this is one that pretty much it's music speech stimulation. So it really helps with developmental parts of, when your client is using or developing their speech, excuse me. So it's the use of musical materials such as songs, rhythms, chants, and music phrases to simulate prosodic speech, gestures to simulate non-propositional speech. So it is the way of, it's the use of using music to kind of remember the way that you, or it's using music to prompt different words to come out. So I always think, you know, I can't hear you or see you, unfortunately. But I always use the idea, if you want to do this at home, of you are my, most of you hopefully said sunshine. So you are my sunshine. It's kind of an immediate reaction. Same thing as if you're happy and you know it, clap your, same thing. It should say hands, hopefully hands. If you're happy, you know, clap your hands. And that it becomes a very like automatic response to respond in that way. So like it says, this technique uses the completion or initiation of overlearned familiar songs, association of words with familiar tunes or musical phrases. So even if your client or patient does not know this song very well, use repeating it over and over and over so they do understand it, and then using, you know, that space to initiate that speech is important. Moving on. Excuse me. Rhythmic speech cueing. So this it's pretty self-explanatory. So it's the use of rhythmic cueing to control the initiation, the initiation and rate of speech through cueing and pacing. I just realized I spelled through wrong. The therapist may use the client's hand, a drum, or possibly a metronome to prime speech patterns or pace the rate of speech. This technique is really useful, especially when it comes to motor planning for apraxia, which is it's very similar to dysarthria, so which is the not lack of control, but difficulties in controlling the muscles for speech, or assistant pacing with fluency disorders. So there will be an example that I will use right now, that if you have taken the NMT course, you will recognize this. It is called the Ickle Ma Pickle Mo Tickle Me Too. Excuse me. So you would usually use a metronome, and I will just use my fingers for this. I should be using a metronome, but just think of it as the beat. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Ickle ma pickle mo tickle me too. Went for a ride in a green colored shoe. Now is the time that we find what to do. Ickle ma pickle mo tickle me too. There's a little bit of a difficult, example, especially because there are a lot of words in that. However, they do, your clients or patients do have that first beat to rely upon to start the next syllables if they need to. So that is an example of rhythmic speech cueing, is using a metronome or a beat to initiate speech. Therapeutic singing. It is exactly in the name. It's a technique which involves the unspecified use of singing activities to facilitate initiation, development, articulation. It's, you know, we see a lot of commercials, you know, that you might see on TV where it says, you know, talk, read, sing. That singing is a very important part of speech development, or in any development, especially if you have a patient or a client who has developmental disorders. That singing is a very, very important way to, you know, initiate that speech or initiate that development, because songs, again, music has a very deep connection with the brain, and using that music is very important. So continuing on. The DSLM, it is using the specific use of developmentally appropriate music materials and experiences to enhance speech and language development through singing, chanting, playing a musical instrument, and combining music, speech, and movements. So this is very important, especially with infants or with children who are developing their speech, because this is the best way to do it. It's truly just developing through music. This is an example, is kind of creating a chant, so that it's easier to relay information that you might need to use. You know, my name is blank. I am blank years old. I am a, you know, boy, girl, or, you know, or non-binary, and I love to activity. So an example, we have another person. Another example would be, you know, my name is Anna. I'm 24 years old. I am a girl. I love to sing. And so using that over and over is it can help and train, you know, in your brain. Continuing on. SYCOM, so symbolic communication training through music. It's the use of musical performance or musical performance exercises using structural, instrumental, or vocal improvisation to train communication behavior, learning pragmatic, appropriate speech gestures, emotional communication, et cetera, et cetera. So it's kind of thinking about improvisation with your clients or your patients, and using that, to teach turn taking or that communication, thinking of a beat. So, if I were to play 1, 2, 1, 2, 3, I would want you all to play 1, 2, 1, 2, 3. And that is that communication that goes back and forth between there. Let's continue on. So this is really going into the speech language pathology and music therapy collaboration. So those were some very useful techniques that you can use in this collaboration, but this is kind of how to make sure you have the best success. So I wanted to give a disclaimer. Music therapists unfortunately cannot diagnose or specifically assess for speech disorders. And we can't treat the disorder itself. So we can't, if we had a client that had apraxia, music therapist cannot be like, oh, I'm going to fix your apraxia. We instead have developed techniques that enhance the treatment and provide alternative techniques that support speech and language in your clients. So again, we unfortunately cannot attack it by itself. We use techniques to support it instead. And again, with a big note with this is that the material that has been shared today is for informational purposes only. It's pretty general. It's not intended and should not be relied upon as a training or treatment or a diagnosis or anything. This is just off of basic knowledge and what I've learned throughout the years. So the main thing about music therapy collaboration, which is, I'm going to be using collaboration, the word collaboration a lot because it is key. It's the process of working jointly with others. The process of working with others in an intellectual endeavor to bring about change, and it implies a shared responsibility. That's like a little definition of collaboration. So really thinking, we don't want to have just a speech language pathologist and a music therapist treating at the same time. We want them to use their own techniques, but we want that collaboration and that talking behind the scenes to really, to help develop speech and language for our clients. We don't want to just be like music therapy, then speech therapy, the music therapy and the speech therapy. It should be one coincided session. So a few little tips about collaboration. We want to make sure that we communicate with one another on how to best address the needs of your client. So again, we don't want to have just like, oh, I'm going to address these needs. I'm going to address these needs. I'm going to address these. That you want to make sure it is, a true co-treatment, that you're working on very similar things. And that the music interventions can be used to enhance and support communication areas that the SLP is addressing with the client. And the SLP can use techniques that they know to address our treatment. So I think it's very important to also have that boundary that you can communicate with each other in the session. If we're using if a music therapist is using a therapeutic singing exercise, the SLP can step in and say, hey, I really think this client should redo this with this breath control. I think we should redo it. Same thing with the speech therapist. If they're doing an exercise or an intervention, we can step in and say, hey, I don't think I think he could do more vocal inflections than when he just did. Let's try that again. So it's using each other really to support. Co-treatment. You don't know really how to do it until you do. So making sure that you do have that experience with co-treating, and that you want two clinicians who know what they're doing and how to work with each other. You want to collaborate on goal development. Again, you don't want to have two separate things. You want to make sure that it's all very, engaged with each other and similar, that you will have very similar goals. They might have like a little differences depending on, the documentation styles for each, or, the very specific units, but the overall goal should be very similar. Have a clear understanding of the other professions' scope of practice. So again, there are things that music therapists can't do with SLP, and there are things that SLPs can't do with music therapy. So we want to make sure that we know, when pretty much in layman's terms, to not step on each other's toes, and to make sure that we are providing, we're really giving each other the right boundaries. Share information with one another, therapy articles, ideas, pamphlets, research, any of that. Really show, oh, I have found that this works with my client. We should maybe try this out. And same thing with the music therapist. I really found this, I want to make sure this works, making sure you're constantly giving each other more information. And the main thing, like any professional relationship, does not matter. You want to make sure communication is absolute key. So if there's anything that comes up in your sessions, especially if one of them misses it, if one of your clinicians misses one session, making sure you bring it up in the next meeting. If you want to change your goals, bring it up. If you want to change your treatment ideas, bring it up, making sure there's a constant communication. And then last, I wanted to go over a little vignette and really show how, beneficial it can be to have these co-treatments. It is a personal vignette that I had a client I worked with quite a while ago, where it was a true collaboration between speech and music therapy. It was a speech therapy student, and I was a music therapy student at the time, and we found techniques to really combine together and to provide the best treatment for our client. And he luckily was a musician, so music was very, very important to him. And not saying that in this collaboration that your patient or client should be a musician. It just so happened that it worked really well with him. And he was a singer. So we found a lot of interventions through, through OMREX, VIT, breathing, different breathing techniques. And that kind of fits in with the OMREX as well. Singing. And we did a lot of song to speech, which kind of fits under the idea of VIT, where we would sing songs together and slowly transition it out of the singing into speech. So it would cause more vocal inflections, and his articulation was a little bit, it was not fully developed at that point. And it was, through these sessions, which we had 2 times a week for about 4 months, the first day he had difficulty singing most of the songs. He would have difficulties speaking because he would not be able to retain his breath. It was very unintelligible speaking too, so it was hard to understand him. And then the last day I had a recording of him, and I unfortunately cannot show it today, but it was almost night and day. That he obviously did not come out perfectly speaking, but his speaking was much more clear. He was able to retain most of his breath. It was just a very, very different type of speech. And that was after 4 months of just constant communication, collaboration between me and a speech therapist. And the speech therapist would, would really make sure that he had the right therapy for SLP, and I would bring in my music therapy expertise. And it would just, again, this is really beautiful collaborative effort. All righty. Here's some resources that if you would like, I'm going to be writing a blog post pretty soon for all of this, where I will list even more resources. So we have the Academy of Neurologic Music Therapy, which has so much information. If you want to look for a neurologic music therapist as well, you can look on that website, and they have them all over the country. The AMTA, which is the American Music Therapy Association, know a lot about music therapy. And then the American Speech and Hearing Association. If you really want to go a step beyond, if you are in California, go and check out CASHA, which is the California Association for Speech and Hearing. Here's our social media. Here's our social media. If you want to check out more of it and keep an eye on our events. And here is the contact information if you want to be able to contact our office. And you can, if you have any questions, especially with anything, you can contact them. And then I will stop my screen share, but is there any questions? I'm going to see if I can. I don't know if you have the ability to start your video. If you would like to start your video, you can. If you have any questions, or unmute. If you have any problems, you can also let me know. It'll take a few minutes. No, I don't think so. Awesome. If you have any other, if you have any questions or anything, you saw these social media, we will also be posting this online and posting this PowerPoint online if you want any other information. And I'm more than happy to answer anything that I can. So thank you all so much for being here. It was pretty short, just a half an hour. And I appreciate you all taking your time. And you can go if you would like to. If you would like to take off your camera, you can. And thank you all so much. Thank you. I'm going to stop recording.